Hello and welcome. Today, we're going to do something pretty cool. We're going to start by diving deep, right down to the microscopic level to see how our bodies pull off the amazing feat of healing. And then we're going to zoom all the way out to see how nurses in the real world manage that whole process. I mean, think about it. You get a cut, you slap a Band-Aid on it, and a few days later, it's just better. It feels like magic, right? Well, it's not magic. It's an incredibly precise biological emergency response that kicks into gear instantly. And understanding that response is a really big deal. How big of a deal? Well, look at this number. 2.2 million. That's the number of wounds the UK's National Health Service deals with every single year. So yeah, this is a massive part of healthcare, and the people right there on the front lines are, you guessed it, nurses. So let's zoom in. The second your skin gets broken, your body doesn't waste a moment. It has a plan, a really organized 4-step plan to control the damage, clean up the mess, and start rebuilding. And here is that blueprint: hemostasis, inflammation, proliferation, and maturation. You can just think of it as stop the bleeding, clean the area, rebuild everything, and then make it strong. So let's walk through it, starting with phase 1. Right, first things first, you've got to stop the bleeding. Within seconds, these tiny little cells called platelets are the first responders on the scene. They all rush in, clump together to form a temporary plug, and then they work with proteins like fibrin to create this strong mesh. It's basically the body's own super fast patch job. Okay, the leak is plugged. Now it's time for the cleanup crew. This is the inflammation phase. You know how a cut gets red and a little swollen? That's on purpose. The blood vessels open up to let specialized white blood cells like neutrophils and macrophages flood the area. Their whole job is to hunt down and destroy any nasty bacteria and clear out all the dead cells and debris. They're like the wound's own sanitation department. So, once the site is clean and totally secure, the real work can begin. This next phase is all about construction. We're turning a disaster area back into working tissue. And this is the proliferation phase. It's pretty amazing. Cells called fibroblasts show up and start weaving this web of collagen, which is like the scaffolding for the new building. At the exact same time, new blood vessels start growing into the site. That's a process called angiogenesis. And they act like supply lines, bringing in fresh oxygen and nutrients. You ever see that fresh, pink, kind of bumpy tissue in a healing wound? That's called granulation tissue. And it's a fantastic sign that the construction is moving along perfectly. And finally, we get to the finishing touches. This is maturation or remodeling. This can take weeks, months, sometimes even years. The body replaces that initial kind of weak collagen with a much, much stronger version. The wound gets smaller as the edges pull together, and the whole area just gets stronger and more durable. The body's making sure this repair is built to last. But what happens when this perfectly timed, beautiful process gets stuck? What happens when it just grinds to a halt? Well, that's when things get serious and we enter the world of chronic wounds. You remember that inflammation phase, the cleanup crew? Well, they're essential, but they're supposed to be temporary visitors. If they stick around for too long, they can actually start causing a lot of damage. See, when inflammation just goes on, the wound site becomes a total war zone. Instead of cleaning, you get constant injury. Those helpful neutrophils, they start dying off and releasing these destructive enzymes that just eat away at healthy tissue. Any attempts to repair the area fail, bacteria start to take over, and the wound just gets stuck. This is how you get those really difficult chronic wounds, like pressure ulcers or leg ulcers. So what you end up with are two completely opposite environments. On one side, you've got a healthy, healing wound. It's got low inflammation, low levels of those destructive enzymes, and lots of cell growth. But on the other side, the chronic wound is a hostile place. Inflammation is sky high, it's flooded with tissue-destroying enzymes, and the cells have basically just given up trying to grow. So when you're faced with this kind of biological stalemate, how do you even begin to fix it? This is where we zoom out from the cells and look at the clinical world, and it all starts with what we can call the nurse's playbook. The guiding principle for all of this is something called medicines management. Now, that sounds a bit formal, but what it really means is having a smart strategy to make sure that the medicines we use are effective, safe, and not wasteful. It's all about making sure the patient gets the absolute best result with the least amount of risk. It's way more than just handing out medication. It's a whole philosophy of care. And honestly, it all boils down to this one simple goal: getting the right medicine for the right patient at the right time. Simple to say, but it takes a lot of skill to get it right every single time. For a chronic wound, that could be the right dressing, the right pain medication, or the right antibiotic to finally break that cycle of inflammation and get healing back on track. And running through all of this, like a golden thread, is an absolute commitment to safety. When you're dealing with something this complex, you have to have crystal clear rules and a strong sense of accountability to keep the patient safe. A great example is delegation. A registered nurse can't just hand off a task. First, they have to assess if the task is even appropriate to delegate. Second, they have to be sure the person they're giving it to is competent and knows what they're doing. Third, they have to give super clear instructions. And finally, and this is the big one, the nurse is still accountable for the outcome. It's a chain of responsibility designed to protect everyone. This whole safety mindset is built on 4 core ideas. You have to have clear systems in place. You need to make sure your team has the skills and the support to do their jobs well. Then you have to actively check that the procedures are actually being followed. And finally, you're never done. You have to be continually improving the process. It's a constant cycle of planning, doing, checking, and refining, all to keep patients safe. So when we circle all the way back to that simple Band-Aid, we can see 2 amazing stories happening at once. One story is about our body's incredible, ancient blueprint for fixing itself. And the other story is about the disciplined, modern expertise that steps in when that blueprint needs a helping hand. It's a powerful partnership, and it really is the true nature of healing.